Has it been a really big struggle as a doctor to choose and decide who gets the testing that you have available?
Yeah, absolutely. It is difficult because I wish I could just test everyone and so that they, are aware that they have it or not. And because I have patients who had symptoms in February, thought they had it, and they continued for months to be just anxious and it affects one mentally. So there's that part of it. So if they had been able to be tested and know and not have that anxiety that's there, thinking that they have passed it on to other people, that I think that would have been great. It is hard for me because we don't do the same thing with the flu for flu swabs. We don't do the same thing for strep throat. I don't just empirically treat them with antibiotics or not and think it's strep or not. I actually can swab them and use my clinical judgment to make that decision. So it is difficult. If they're very ill, then I do send them to the emergency room and have them be seen in the hospital if I think that they're going to be admitted. And that I made those calls, and they definitely did need to go, have low oxygen levels, and definitely did get admitted to the hospital. It's those cases are kind of in the middle, so it just makes my triaging skills a little bit more difficult.
In what ways do you think or hope that our city, county, nation, or just the St. Louis Asian community in general will change after the pandemic?
I think that right now there is a lot of racism and xenophobia, and unfortunately that will have an impact on the Asian American community, because we're going to be more weary and worried about what we say and what we do and how others view us. So I think that's going to make have an impact. I know that being out in the community, even myself, I've kind of feel like the way people perceive me or the looks that get from others is a little bit different now than it was before. And I don't think that's just all me. And I've heard this from other friends too, because people look at us and think we may be Chinese, and I get it when I wear scrubs too, not just that part of it, but it's the also there are people who have negative thoughts towards healthcare workers. So I'm wearing scrubs sometimes and they're clean, but like I go to my dad's house and I have to shower right away as soon as I get home, and then my dad gives me scrubs to wear, so I'm wearing his clean scrubs, but and then I go out to get gas and I'm like getting people like giving me looks, or when I wear a mask, there are people who are anti-mask and I feel like I'm getting some looks there. But I think that the Asian community is going to be a little bit more worried about the racism and the xenophobia that's out there due to this.
How do you think the government should have approached the shortage of testing and personal protective equipment differently?
I think it is hard to have known that this would be the case, and what short supply we would have. Normally in the hospitalist world, when I'm working in the hospital, I use one mask, one gown, one glove, and I go in to see a patient, I throw it away, and then I go to the next patient and use new ones. I could use like 5 or 6 of them in a day, like just not even think about it. And never did I ever think that we would be to the point where we'd be using one for like weeks at a time, one mask for weeks at a time. I think that if I know I've read articles about people saying that this is something that has been brought up years ago, that we need to be sure to have enough equipment and things like that. I think that if we had that in place way before, that would have been great. I think that if our leadership were able to come out and say from the very beginning, look, this is happening in January, this is starting to be a big deal in Asia, and we need to be prepared for it to be here. I think that leadership and the ability to educate the public from the very, very get-go would have been great. I personally initially even said, oh, it's just like a cold or like a virus, it's just like the flu. And I wasn't the only one. I think most people felt that way initially, especially, and many doctors did too. And then slowly you could see the perceptions change as more information, more science, more data was available. But we had to do our own digging and our own looking for it. And us as scientists and as healthcare workers had to do our own finding of information. So I think if we had leadership to have been out there from the beginning and give us information, give us the science and give us the data and come together, I think that would have really helped, instead of us being 50 different states with 50 different ways of doing things, and different cities in each state doing things different, and different hospitals in the same city doing something different. It took months before, it was probably like a month or two before the St. Louis area developed the Metropolitan Task Force, where the three big hospital systems came together and shared information. That could have started weeks or months ago. Leadership could say from the top, hey, governors, let's start doing this. Hey, governors, tell states to start, your own cities to start doing this. Instead, I was emailing my sister numbers from Mercy, and she was emailing me numbers from SSM, so we could see what was going on in each other's hospitals, and it took a while for them to come together. So a top-down approach with strong leadership would have trickled down to everyone else.
And how will you look back at the COVID-19 pandemic?
I'm going to look back at it as a time where, I think I'm going to look back at it and be proud of myself for pivoting and making changes and being very careful so that I protect my patient population and my community. I don't think I have a voice for everyone. I don't think I have a loud enough voice for like all of the state of Missouri, but I think I have an impact in my city of St. Louis, and I definitely have an impact in my Vietnamese American community, because in that community, my family's been known for 2 generations now. We've been in this community for 40 years. So there's I think that my voice carries more weight in the Vietnamese American community, and so that's why I take to social media to make videos so that I can educate those patients in Vietnamese, because there aren't very many Vietnamese Americans today who still can speak Vietnamese or read and write. And so I pride myself on that, and use that as an ability to help educate these elderly people who their English is not very good.
What are your main takeaways from this experience?
I think the main takeaway is always have an open mind. Anything can happen at any time. There's no way I could have predicted that something like this would happen and we would be in this situation. But always have an open mind for, anything can happen, and we can, anything can happen anytime. As a physician, I know that death and dying is a part of life. So I'm very realistic about that. So, I know that could happen for people I love, or for anyone, for any of my patients. So I see that on a daily basis. But something like this, where a national disaster is something that can happen, and I've got to be open-minded about that too, and just taking a step back and learning how now to be a teacher. I'm homeschooling my children, so always be there to learn. And I think that the fact that I love to learn, and that's why I became a doctor, is because I love to learn. That is good at this time, because I'm reading constantly, like reading articles coming out of China, reading Journal of American Medical Association articles, and things coming from other physicians all the time. So, but I think that I also need to learn that people are divided. Politics divides people, and certain topics divides people. And I'm just learning to use love, to have love take over fear, and to try to bring people together, instead of continuing to let politics pull people apart, and let things pull people apart.
Is there anything else you want to add, or any final notes you have?
Wow, I think that there's going to be a new normal. I think that new normal is going to be where we're going to be very respectful of each other's space, and having to understand that we're not going to go back to to just being able to hug everyone, although I'm a hugger, being able to hug everyone and be close to everyone all the same time. Big conferences are going to change. Things we do are going to change. Um, and I really hope that what we're seeing with some people starting to be negative towards healthcare workers and things like that, that's not going to be something that's just going to be a small subset of people and not the community at large. I want people to know that people who go into medicine, we give up very much of our younger years um, to do this. It was very difficult, 80 hours a week as a resident, working and not being near family, not being near anyone else, not going to spring break or summer vacations like other people do. It was really to sacrificing a lot to be where we are, to have the knowledge that we have to take care of patients. And many of us in healthcare really are passionate about what we do and caring about people. And when certain things happen, like with a new disease like COVID, if there are mistakes that happen or what we're trying to do, we're trying our best. This is a new disease and things are so new. And I know there are people who are blaming doctors and nurses who aren't able to take care of patients the best they can. In New York, for example, I mean, they're doing the best they can. So we're all human. And I just really want everybody to take away from that is that we really need to just be more kind to each other. I think that's the most important thing.
Yeah, so thank you for being here today. I will